Howdy folks, this is Dr. Z returning for the last story of the day, VEDA, on day 14. It's been a great mini project for me to talk about the many experiences I've had while practicing, and I hope to continue that in future videos. But like I said in the last video, I'm just going to do a quick story about one thing that at least a lot of pharmacists get frustrated with, and that is communication with doctors. And don't get me wrong, I like doctors. I like talking with them professionally, especially at meetings and such, but in the role of a pharmacist in practice, it is extremely frustrating, and I'm sure patients are able to understand as well, especially if they're trying to get a last-minute appointment with them or anything like that. One frustration that a lot of people have is when it concerns controlled medications, or medications that have special precautions around them because of their ability to become abused or become addicted to them. Those are medications to look out for, especially when you're a pharmacist. One time I saw a patient come in, they gave a Percocet prescription, and Percocet is oxycodone with Tylenol, and on the prescription it said 10-350. And as many people are aware of now, the FDA outlawed anything that had a Tylenol component of 325 milligrams or higher, because it really hits your liver pretty hard, and it caused some liver toxicities and liver failure. 10-350 is something of a stretch. It doesn't exist because there's 10-325, there's 10-650s that used to exist. At least in Illinois, when you get a prescription for a C2 that is not commercially available, then you have some leeway that you can work with. If they wrote for something that specifically is commercially available and I could take it off the shelf and dispense it to the patient, if that's somehow wrong, I can't do anything about it because they have to write a new prescription in Illinois. In that gray area with 10-350s, the patient's like, I really need this medication, I completely understand, but this doesn't exist, so I need to call your doctor to figure out what in the world he wants. I called the office, and of course it's Friday, it's after the office is closed, and they're closed throughout the weekend until Monday. I had them page the doctor on call. If they're closed, they have an after-hours phone that you can call. Most of the time that's great because sometimes the doctor on call is the doctor you need because they're usually the last person that's seeing the patient before the weekend, and so they kind of stay on call. This time, not so much. I waited about an hour before the doctor called back. It wasn't the doctor that prescribed it, it was the doctor on call. He said, "Hi, this is so-and-so from the blah blah office, how can I help you?" Well, this patient was seen by this other doctor in your practice, and he wrote for Percocet 10-350s. Well, what's the problem? It doesn't exist? I mean, you're a doctor, right? You should know these drinks. Well, I'm sorry, I'm just new here, and well, even then, you probably had about 8 years of practice of getting exposed to these different medications. But anyway, whatever. Because it doesn't exist, I need your authorization to figure out what prescription he was trying to write for. Well, how do I know? I don't have the patient's chart in front of me. Well, can't you guess? I mean, I need it to come out of your mouth. I can't modify it without a doctor's approval. And if you don't say it, then I can't dispense it. I didn't say that, but that's what's going on in my mind because, and on one hand, I could have just gone that extra step and said, okay, I understand what the doctor was saying, but in my mind, he could have been writing for the 10-650s, which don't exist, which means they need a new prescription anyway. On the other hand, he could have been writing for the 10-325s, or he could have been writing for some other prescription. And so I need to verify it before I can dispense it. After I brought that back up, it doesn't exist, I need to figure out whether he wants 10-325s or 10-650s. Which do you think is more likely that your colleague's going to write? Oh, the 10-650s, because those are better. Well, those don't exist either, because the FDA. What about the FDA? Do you not have any clue about modern medicine whatsoever? You're so new that you were practicing on your cave for the last 3 years. Whatever. Your competency is not amusing. Is it Percocet 10s? Yes. Awesome. Have a great night. Click. Fill the prescription, and we go. At least bringing back that sort of cynical pharmacist in me on, we need doctors who are competent in what is available, or even bring back the notion of pharmacists being able to prescribe. Give us a diagnosis, we know what should be the best medication forward. We know the guidelines, we know what should be first line, second line, third line. Just give us that authority. It's so backwards anymore. But again, I'm new, still have to appreciate that history and appreciate the practice a little bit more. But at the same time, when you have these situations from doctors, it's frustrating as hell. So that's the last story of the story project I had for VEDA 2014. This actually brings up a good moment to bring up that in VEDA 21, I will be doing viewers' questions and comments. So if you have questions, if you have any comments, hit me up in any of the comments of the videos. Hit me up on Twitter at Harry_Zoll, Z-O-L. Let me know and I'll answer things. If you're watching this from Facebook, just hit me up with a message. I'm not expecting a lot of things coming my way, but surprise me. I really want to see what you guys think. Beyond that, like and share my videos, subscribe to my channel. This is Dr. Z, signing out again for VEDA 2014. See you tomorrow.